Welcome to the UW Health and your first step in our diabetes education program. During the next few minutes, we would like to introduce you to George, a person who was diagnosed with diabetes about a year ago. George and his wife Irene know firsthand the journey of living with diabetes that you are about to take on. During the next several weeks, you will be meeting many new people to help you manage your diabetes. During this video, George will introduce you to several of these healthcare professionals. So again, welcome to UW Health and the Diabetes Education Program. And please know that you are not alone in living with your diabetes, and all of the people that you meet on your journey at UW Health are here to help.
Hi, I'm George, and yes, I have diabetes. It happened about a year ago. Now, before you think another thought, I want you to know that there isn't anything that you're going to say, do, think, or feel that I or anybody with diabetes hasn't already said, done, or gone through. I know there's going to be a lot of questions, concerns, fears, and worries, and I'm here to hopefully answer some of those beginning questions for you. Afterwards, I hope that you'll take some of this basic information and go over it with the nurse in the clinic. And if they haven't already set you up with a blood sugar meter, they can do that there, and you can start checking your blood sugar levels right away. And by the way, when they say that they're here to help, they really do mean it.
Hi, George. Hi, Irene.
Hi, Dr. James.
Good to see you today.
Good to see you today.
Do you remember when we first discussed your diabetes?
Oh, wow. That's a day I'll never forget. My whole body went numb. I don't even think I heard a word that you were saying. I didn't know one person could feel that many different emotions all at one time. I mean, why me? What did I do to deserve getting diabetes?
I remember that day. I thought our lives would never be the same. I mean, I'm not a nurse. I didn't know how I was going to take care of you, George. Maybe George's getting diabetes was my fault. Maybe I wondered if I didn't cook the right foods, or maybe
I was just as worried as you were. I mean, what about our retirement and me going to work and paying the bills? And I just didn't want you to have to worry about taking care of me. But I also remember that you introduced us to a whole lot of people who were going to help us and that we weren't going to be alone.
We brought together your diabetes care team.
I could not believe that all these people wanted to help us. A nurse, a medical assistant, a dietitian, and a diabetes educator. All these people to help me and Irene.
I thought the best part of the care team was that we were in charge. Well, you know how you like to be in charge, George. And I could help plan his care, and that the team would work with us and help achieve George's goals.
Hi, George. Hi, Irene.
Hi.
I'm Michelle. I remember the first day you guys came into the clinic to learn how to use the blood sugar meter.
I didn't think George was going to be able to test his own blood sugars, but you made it look so easy with just a little bit of blood.
Yep. And my first thought was, well, you know, I got myself into this fix and I'm just going to have to grin and bear it.
No, but honey, remember.
Well, I know. Having diabetes isn't my fault. Do you know what a relief that was to hear you say that? And now I know that all I have to do is check my blood sugars and call you with the results. And to do that, I've got my meter. I still don't like being poked.
Wow.
But I do like knowing the results and knowing how the food I eat changes and affects my blood sugar levels. And knowing that information helps me to stay on track.
Was it helpful to know that you could call the clinic with any problems or concerns you might have had?
Oh, yes, very much so. And it's also great that there's a 1-800 number on the back of the meter so that when I get in trouble and the clinic's closed, I've got someplace to call.
Especially that first week, we had so many questions. But not sure that we were doing the tests correctly. It was so helpful knowing that we could just call in his results, and there you would be to help us, to let us know if we needed to adjust any medications. And once we were on my chart, the reporting of his blood sugar was even easier.
I mean, the one thing, we were kind of worried about having all those needles around the house, but having the Sharps container or an appropriate laundry bottle certainly helped to solve that problem.
And how did you like the Living with Diabetes book?
Well, at first, we liked having every single bit of information that was available to us, but then it became a little overwhelming. And every place we looked, the information seemed to tell us to do something different.
You organized the first information for us, and the handouts were easy to follow. And then when we needed more information, we were able to get the materials in a way that we needed and knew we could use them.
And we started with just a basic book and went through it page by page. I gave you your plan and your goals sheet.
You started me with eating and exercise, and everything I needed to know to get started with was right here in one of the circles. So eating 3 meals a day, eating smaller portions, limiting fruit juices, and regular beer and soda. And then finally, making an appointment with the dietitian.
The exercise was the harder issue. We both needed to be more active. And you gave us some suggestions to get started.
We then talked about the two of you going to diabetes classes and learned about the disease, what to eat, and how to stay healthy.
I thought the classes would be a good idea, just knowing that there were other people going through the same things we were. The nurse and the dietitian were so understanding. They understood our questions and they calmed our fears.
Yeah, I thought, I didn't really want to go to the classes, but I met a couple guys just like me going through the same things. And so we were able to keep each other motivated and keep ourselves on track.
And when all else fails, you had a number to call if you had any problems or concerns.
George, it's so good to see you
Good to
again.
see you.
I can't believe a year has gone by so quickly.
I know.
And your wife is Irene, right?
Hi,
Nice to see you again, Irene. I'm Sarah, in case you forgot.
nice to see you.
I have to say, you were the one person that I really didn't want to meet.
Sarah, George thought that you were going to scold him for being overweight and force him, us, to go on a diet.
Oh.
Yeah.
Well, tell me, what is the one most important thing you remember from our visit 1 year ago?
Oh, that's easy. Eat 3 meals a day and don't skip meals. I thought that was just great. I mean, here you are telling me to eat instead of don't eat. And I never realized that skipping breakfast in the morning made me so hungry by the end of the day. And that contributed to my overeating at night. And now that I'm balancing my meals, I've been able to regulate my blood sugars better.
I had thought I'd have to cook 2 separate meals every night, one for George's new diet, one for the rest of us. But if George chooses healthy portions like that, our regular food seems to be just fine. I was thrilled I didn't have to buy special diet foods. You help both of us look at food differently. It's helped to use some of the ideas from class, too, like using smaller plates at dinner.
The message that we give to everyone here is that changing lifestyle habits takes time. So I'm really glad that our discussion about taking small steps to change your eating habits, it sounds like that's paid off and has been successful for you. It's amazing, and people are surprised that a small change, like changing from regular soda to diet soda or staying away from other sugary drinks like juice, can really bring blood sugars down for people. And setting goals is so important so you can take it step by step.
Well, George's first goal was to change from the regular soda, 4 regular sodas a day, to diet.
I couldn't believe that my regular soda had 10 teaspoons of sugar.
That's
I
a
mean,
lot.
I thought it might be better with juice, but I guess there's sugar in that too. So now I'm trying to drink the diet stuff and get used to that. It's going okay.
Some of the changes I made, George didn't even notice. Like, I'm not adding butter to our vegetables. I've changed to a different cooking oil. And now I'm using Mrs. Dash instead of salt.
So now I think after a year, we're ready for some larger goals.
Excellent. Well, let's get started setting your next goal.
So I guess adding whole grain breads and cereals to my diet is part of the next goal. Yeah, all right. But I don't know. I don't know about this 100% whole wheat pasta.
Well, Sarah, the dietitian, said that the flavor isn't that different from what we're accustomed to. And it's got a lot more fiber, so let's give it a try.
Well, it might help with the next part of the goal of putting smaller portions of noodles on my plate. Oh, and I guess I'm going to have to start eating more of these vegetables, especially these green ones.
Oh, I'm going to try that recipe that we learned in class for the roasted cauliflower tonight.
Hi, George.
Hi.
Hi, Irene.
Hi.
I'm Barb. I'm the diabetes nurse educator. And I met with you last year when you were first diagnosed. It's so nice to see both of you again.
It's good to see you too.
So let's start today about talking about how you're doing with your activity goal that you set the last time that we met.
Well, during our first meeting, I thought I was going to have to become an Olympic athlete. But, just like Sarah, the dietitian said, it's going to take small steps to change my diet. And so it's going to take small steps to increase my activities.
So tell me about those first couple of months. How did you work on increasing that activity goal?
Well, my first goal I thought was I've always wanted to run in the Crazy Legs run.
And then we discussed that we should choose a smaller, more reasonable, attainable goal and become more active together.
Yeah. So my first new goal became not driving around the parking lot looking for the spot closest to the front door, and instead parking as far away as possible and walking in.
Yeah, I laughed. I was sure he was never going to keep up with that goal, but you sure did. And now we're circling the parking lot looking for the furthest spot away.
That's right. And so after a year, I am proud to say that we go walking 3 times a week. Well, almost every week.
That's great, George. Congratulations, and you should be proud. You started out with a small goal and built upon it over time, and now you've made activity a part of your daily life.
You know, if you'd asked me if I would go walking 3 times a week, I just don't know that that would be something I would agree to. But now, you know, even a short walk after dinner is pretty easy.
That's so good to hear. What do you think helped you to be successful with meeting your goal?
Well, I can answer that question. George would never walk alone at first, and so I always had to be ready on time to go out for that after dinner walk. But now, if I'm not ready, he goes out walking with the dog, and I miss my evening walk.
Good for both of you. It sounds like you've become quite a team.
This is Julie, the medical assistant from the clinic, calling to remind George of his lab appointment.
At first, I was a little nervous when the staff would call to remind us of lab draws and other appointments. But then it wasn't long before we got into the routine, and now I'm not at all surprised when they call with a reminder.
That's right, next Tuesday at 3:30 in the afternoon. The lab will see you then. Bye-bye.
Many people tell me it's hard keeping track of and coming to all their clinic appointments and their diabetes classes.
Well, kind of, but, you know, the clinic is really helpful with that. And what you don't know is what that we were both thinking, you know, after the first few meetings. It was like, is that all there is? I mean, we really didn't want the meetings to come to an end, and we didn't want to end up feeling stranded.
I know George might not want to talk about this, but we were both afraid about the future when we started out. We went through difficult times with his Aunt Catherine. She struggled so hard with diabetes, and we were going to do everything we could to make sure that it didn't happen to him. And we were so grateful to find out that the care team wasn't going away.
As a clinical psychologist who works with patients with chronic medical conditions like diabetes, I'm aware of how our personal experiences can influence our coping. Let's take a minute and talk about your memories of Aunt Catherine.
Well, first off, you know, just having somebody to be able to talk to and share my concerns and fears has been so helpful. You know, I don't think that my aunt had anybody that she was able to talk to about her disease or to learn about her disease or even to have the kind of support that we've been getting in the clinic.
I'm glad you've decided to attend our group. We try to focus on coping with the future and dealing with the disease of diabetes head on. We leave information in the clinics so that people can call us for more information about the health psychology group sessions.
If anyone would ask us about a group like yours, with other couples going through the same things we were, all I can say is it was a blessing.
The first year after a person is diagnosed with diabetes can be a challenge even for the most prepared person. However, living with diabetes has changed much over the past few decades. We now know so much more about the disease, what causes diabetes, treatment options, and how we can help people cope and manage the course of their diabetes.
As your diabetes care team, we want to help you live better with your diabetes. As your doctor, I'll be wanting to meet with you twice a year for checkups.
As your nurse, I may call to check on your blood sugars and may tell you to increase your diabetic medications.
As your medical assistant, I will call you when your labs are due, and I will also check your feet when you come to see the doctor.
As your diabetes nurse educator, I will help you learn about type 2 diabetes and provide you with information and skills that you will need to manage your blood sugars day to day.
As your dietitian, my job is to teach you how food affects your blood sugar. I'll help you understand how to eat so that you can manage your blood sugars and your weight and still enjoy the foods you love.
I'm not alone in managing my diabetes. UW Health has asked me, and now they're asking you, to become an active member of your diabetes healthcare team. Your job is to come prepared for all of your clinic visits and to help you remember all the things that you need to inform your diabetes healthcare team about. There's one word to remember: sugar. S-U-G-A-R.
S is for symptoms and feelings. Tell your doctors or nurses if you're feeling dizzy, weak, tired all the time, or have any tingling in your feet. Also, talk to them if you're feeling depressed or frustrated with your diabetes. You'll have a variety of emotions at this time. Talk to your doctors or nurses. They want to know how you're feeling.
U is for understanding your tests. You will need many tests and exams on a regular basis. If you do not understand why we are doing these tests, please just ask and we'd be happy to explain them to you.
Remember, this is your diabetes. G is for going forward. My diabetes isn't going to go away, and I need to work with my healthcare team to manage it over the long haul. I need to work with my diabetes healthcare team to meet my goals of healthy eating, exercise, and blood sugar testing. And most of all, I need to talk with my diabetes healthcare team when I need help and not waiting for something to go wrong and doing nothing at all.
A is for asking questions. When you come to your clinic appointments, be prepared with a written list of questions or concerns that you can discuss with your diabetes care team.
Oh, and they won't know how to help you if you don't ask.
R is for routine medications. Bring your medications, your vitamins, your herbal supplements, and your over-the-counter medications with you to every diabetes appointment. I will go over your medications and make sure you are taking them correctly and answer any questions that you might have at that time.
We have both learned that diabetes doesn't have to control your life. Be an active member of your diabetes care team. Help them help you.
Being told that you have diabetes isn't easy, but working with your doctors, nurses, and all the other people at your clinic can help make living with diabetes that much easier.